I'm not going to ask how many of you teach, because probably if you're involved in research or clinical work, you have taught at some point, or you will teach. When we talk about teaching, we have to descend from the heights and the ivory towers of randomized controlled trials and all the good evidence that we have to murky waters of teaching, where I'm going to present a very biased and very confounded single case study of a non-drug intervention. Because teaching is very difficult to do well, and there is little evidence how to do it well. We recently did a systematic review on mentoring, on interventions for mentoring in medicine, because we all talk about importance of mentors and mentoring. And actually what we found was that there was really no evidence for good mentoring. Because there were no good, methodologically good studies in mentoring, and the only conclusion we could make was that more rigorous, methodologically rigorous studies are needed before we can know whether some educational interventions is good. And when you teach, first of all, you have to ask yourself as a teacher who you're supposed to teach, at which level, especially when we're talking about reporting guidelines. Who should the teachers be? And also when and how to do it. And when we talk about these processes, we're in healthcare and we would like to do it well. And then you think about on obedience, the quality insurance. And we have, for example, for reporting guidelines, we have structure, because we have these guidelines that are checklists, and it's something that seems very easy to implement. And we know what we want as an outcome, which is high quality publications of research in healthcare, so that it can be applied to practice. As Paul talked in the previous lecture. But then when you ask about the process, is it the journals? Because it's about reporting guidelines, the journals are using it. So should you do it at the level of the journals? Or maybe is it the responsibility of researchers and authors? Maybe it's a part of a continuing medical education, or should it be done at the institutional level during formal training, either at the postgraduate, like doctoral studies and so on, or should it be at the pre-graduate curriculum level? And these were the questions that we asked ourselves when we started to publish a journal in a very small academic and research community in Croatia 20 years ago. It sounds scary when you think back, how long we've spent on this. And I'm going to talk about our experiences as editors, but also as members of academic community, where we teach students and all other participants in medical professional education. And we're going to talk about how we as editors were in a way forced to act, which is the theme of this conference, because we couldn't just stay away from the responsibilities and the problems that we faced. What we were faced with is that very early on in our editorial work, we learned that our editors do not know how to write well. And we have made it official policy that we have something that we called author helpful policy. We first called it author-friendly policy, but it was pointed by someone that we often were not very friendly to our authors. And we helped them. We would sit down with them using reporting guidelines and say, look, this is what you have to have in your paper in order that it should, we would work with them even before we would send it out for peer review. So we tried with them, especially when the topic was of interest. We started our journal in war, and our niche for our journal was, different types of trauma, public health issues, crisis situation, and so on and so on. Then when we would work with them using reporting guidelines, we would very often see that the problem wasn't with the language or the presentation, because we come from a non-English speaking country, but that the problem was methodology. The study wasn't done well. And then, you cannot correct that. You can correct everything else, but if the study wasn't done well, then you cannot do much about it. So we tried to work with the authors, and we did kind of institute it as a policy, and we looked at our role as editors in a small journal, in a small community, as educators of our authors. Then we also worked with physicians, because we tried, okay, if we offer them workshops and courses, maybe that will help. We also worked with postdoctoral or doctoral students. We taught at the doctoral level, the doctoral schools. And when we summed all the experience and the results that we have, we even did a little kind of case control study of the authors that we helped and the authors that didn't receive our tutoring at the journal, and showed that they would publish more papers, but nothing else than that. And we thought, okay, maybe the best thing is to prevent this. Maybe we should have a public health measure and go to prevention and go to medical students. And this is what we started very early in our work, and focused on teaching students, because we believe that if you don't start training early enough, then it's too late. So we managed to convince our administration at the medical school that they should institute a mandatory course on research methodology, critical thinking. So we thought it should be early on, and it was in the second year of medical school, which lasts for 6 years in Croatia. And surprisingly, all the other schools accepted this. So now this is a standard course in all medical schools in Croatia. But then when we did the evaluation of this, using we had a cohort study of students that we followed through all the 6 years. We also used a non-randomized trials of an intervention of such a course. And we found out that we can increase the positive attitude towards science and research and critical thinking among students, but it doesn't last. If you do it only once, it doesn't last. So we were then thinking of how to improve this and what to do to, in the end, have better reporting and better research, and have doctors that would be able to read such reports and then implement them in their practice. When we started thinking about it, we first had the principles of added learning for us to think about in structuring how we want to ensure that students, when they enter their professional life, have the knowledge of critical assessment of paper, and if they want to do research, how to do it well. And these are the 6 principles of added learning, because if you teach about something, it has to be by the teachers who have deep understanding of research. It has to be extended, the curriculum, the teaching has to be throughout the curriculum. Each educational step has to be problem-oriented. It has to build on prior knowledge. You have to encourage students to share experiences, and you also have to adjust it to specific students' developmental differences, learning preferences. And this is what we came up 3 years ago of a vertical and horizontal integrated course in critical thinking, research methodology, and evidence-based medicine, where we start with the first year of medical school, teaching students basic knowledge, then building up on their skills, critical assessment in evidence-based medicine, and finally, because students have to do their thesis to get an MD degree, they have to write a research protocol, and they have to do some research in order to have their degree in the end. I will just go very briefly on what we do. So in the first year, we're concentrating on knowledge, and we think that the students of medicine have to really learn a lot of statistics. My research area in medicine is animal research, and I always tell students that it's not us basic scientists that force them to learn statistics. We need very simple statistics, but they, to be good doctors, have to know much more and much more complicated statistics in order to understand the evidence and apply it in practice. So we really concentrate on, what is research in health, how to read an article, what are study designs, and the basic of statistics too, just in order to make students not be afraid of numbers and to look at them, with a clear mind and open mind. In the second year, they build on this and practice. We cannot have actual, practical research work, so they collect data, but they receive a database, and then they have to analyze it, and they have to present it both in a written form and an oral form. And then in the third year, we really hammer on evidence-based medicine, and really third-year medical students who have just, are about to enter clinical practice love this. They love calculating NNTs and seeing, what it means when it is applied to a single patient. Then at the fourth year, when they having their clinical rounds, clinical rotations. We have journal clubs, which we do with colleagues from usually internal medicine department, where we read actual papers about the problems they study in their clinical rounds and discuss, we go through different study designs and discuss that. And then the 5th year, they have to write their protocol for their own research. And it's, very structured, and we ask them to think about everything they should think when you're planning research, because this is what we saw as editors, that most often when you start writing a paper, you realize that a study you did wasn't good. So we thought, if we teach them how to think and plan for what they do, it will be much better for them later on. So we do ask them to have all these items and to even think about a publication plan and the authorship of the paper. And then we have a lot of time with them to work on in the 6th year to work and give them methodological support and kind of critical thinking support about what they do for their thesis. And when we did all this, then you read literature, and I just want to emphasize with few examples how it fits with what people have been saying and medical schools haven't been doing for a very long time. This is a quotation from Tom Chalmers, which probably many of you know as one of the important and leading figures in randomized controlled trials in the United States, who said, we shouldn't teach molecular biology now and Krebs cycle at his time. We should teach statistics. And I like his saying that in medical schools, I think we have to just hammer away at evidence and probability theory and general statistics. And this is what we have seen as journal editors, that this is probably the crucial element of teaching modern medicine and modern health practice. And then recently, we have been doing this for 3 years, and then in January of this year, I read an editorial in a newsletter of International Society for Evidence-Based Healthcare by Peter, who also said, is it going? Okay. Push really, okay. Okay. So that they said in the editorial that a medical course shouldn't be just a course, it should be a life course, and that the skills in question recognition and formulation and searching and critical appraisal should be taught as seriously. So it shouldn't be an elective or shouldn't be just kind of extra thing, but should be a part of the formal curriculum. And this is what we have also seen, in education, there are usually, 3 types of curricula that you can define: a formal one, informal one, and a non-curriculum. What you don't teach also sends a message, and we thought that, sending a clear message that this is an important thing to teach is an important step to learning proper critical thinking. We also teach students to formulate clinical questions and find answers before the next teaching session. We also try to train them, how to explain this evidence to a patient, and we collaborate with our family medicine department, where students, during their consultations in family medicine offices, they have to look for answers for their patients, that have to write a letter to the patient explaining their condition or a disease and giving advice on how they should, what type of medication they have to use and how to change perhaps the lifestyle. And we also teach them to, link, not only to look at evidence, but also to look at what is important for the patient and their individual needs. And we also have, since 1996, I think, we have open book exam. And students, I know, always wonder and they say, oh, great, we don't have to learn for this. And most of the time on a test that we have in the end, they spend leafing through the book, not knowing where to look. But it has been a great experience, because we also want to tell them that there are always resources that they can go to and look up and use in their practice. And we fully agree with Paul and his colleagues and their conclusion in their editorial that said that if you leave the learning of these skills to chance, or to after the initial curriculum is too late. It's really too late. And if you are interested in kind of standards of medical education, the World Federation for Medical Education, which provides guidance to medical school on how to structure the curriculum, just released the revision of their global standards for quality improvement in medical education. And one of the changes was a really, serious message that medical school must, throughout the curriculum, teach principles of scientific method, including analytical and critical thinking, medical research methods, and evidence-based medicine. And they should include elements of original or advanced research. It must be a compulsory part of the curriculum, and it has to include obligatory or elective analytic and experimental studies. So in the end, when you think about how to train for better research reporting, I think that the answer is that you have to train for critical thinking and for research very early on in medical school, and only then the process will not be such a complicated path of roads where you really need good luck to arrive in the end to a physician who can critically assess the information that is needed for the patient, but it will be a more straight line where physicians are more confident about evidence, about what they do and the research they do. Thank you.